What can we learn about the worship practices of the first Lutherans from a Reformation edict by a Calvinist leader? Find out in Will Whedon's column in the latest Issues Etc. journal. We'll send it to you for free. Just click the red journal subscription button at issuesetc.org and enter your email address. In the Wittenberg Trail feature, Pastor Michael Hughes writes about his journey from progressive Lutheranism to confessional Lutheranism. The Issues Etc. journal. Subscribe for free at issuesetc.org. There is a lot of confusion among the laity about psychiatry and its nexus with Christianity. When should a Christian seek psychiatric treatment? Are there some protocols for that one might know for themselves or for a loved one? Welcome back to Issues Etc. Joining us for the conclusion of our three-part series on Christianity and psychiatry, Dr. John Flo, a board-certified psychiatrist practicing in Missouri, a layman in the Lutheran Church Missouri Synod and son of an LCMS pastor. Dr. Flo, welcome back.
Thank you, Todd. It's a privilege to be back. Thank you.
How would you respond to someone who's entirely skeptical about the effectiveness of psychiatric treatment?
Yeah, like I've mentioned before, I don't shy away from skepticisms or criticisms. I think there are things going on in the mental health world that should be questioned and need to be addressed. We definitely need to continue to improve the field, both on the diagnostic front and the treatment front. And honestly, the more I learn about neuroscience, I understand the skepticism even more. For some perspective here, we're talking about a brain. All of us have this brain that's thought to have about 80 to 100 billion neurons. So that's the individual cells within the brain. And each of those neurons is connected to thousands of other neurons. And so the thought is that there's about 150 trillion or more synapses or connections in the brain. And on top of that, the brain is constantly remodeling and changing. So the idea that we could do anything, any sort of intervention to have a consistent positive effect on a person's perceived experience is mind-blowing to me. So, it's just, we are truly fearfully and wonderfully made. So I think that's a helpful perspective to have. But when it comes down to actually making the case for the effectiveness of psychiatric treatments, we really need to agree upon what data are we going to use, what language are we going to use, how do we even measure these things. And there's a parallel in my mind in the religious debates. If we're going to be talking about differences in religion and faith, we have to agree about what source we're going to be rooting our faith in. We have to talk about scriptural authority. If we can't have that established, then we're just going to be picking and choosing and kind of groping around in the dark. So similar to that, in the scientific realm, we have this body of scientific literature. And of course, it's not the same as the Bible. It's not the revealed truth of God, but it is something. And when it's done well, I believe it's reliable and gives us very good information. And I don't think many people know this, but it wasn't until the 40s that we really had our first randomized clinical trials. And so those are specific trials that are designed to minimize the effect of things like placebo or just random chance leading to outcomes. By the 60s, we started to have a more standardized expectation that trials will be set up in this randomized controlled way. But since then, we've built up a lot of information. And from my perspective, there's more than enough to support and justify the use of these psychiatric treatments. And of course, I've seen that in my personal practice as well.
Overall, how effective are psychiatric treatments?
Yeah, and it really comes down to the accuracy of the diagnosis and the type of treatment that you're pursuing. So again, there's a parallel in the church. It's the proper application of law and gospel. If we're using these things appropriately, they will have their beneficial effect. Similarly, in science and psychiatry, if we're using our treatments appropriately, they will statistically work, and I've seen that to be true. But if we're misapplying the treatments, we can't expect it to be effective. So when I think about the big picture here, how many people in the world are struggling with some sort of mental health symptoms? The numbers are massive. There's a study in the Lancet this year, actually looking at the global burden of disease for mental health. And they reported 1.17 billion mental health cases in the world. To me, there's something that doesn't sit quite right with that number, just from my perspective, that I really view these severe mental health cases to be more along the lines of 1% to 5%, for things like schizophrenia and bipolar disorder. I think that number gets so big because it starts to include all these different types of anxieties and depressive moods and things that people are experiencing. And in my mind, that's a problem. There's so many reasons why people don't feel well. And the first thing I think about as a Christian anyway is that many of these people are not receiving the means of grace. They're not connected to Christ. They're not having their spiritual health attended to. And we can't expect people to feel well if they don't have that as their foundation. And I think of that St. Augustine quote where he says, you have made us for yourself, O Lord, and our heart is restless until it rests in you. So with that in mind, if we're not receiving God's gifts and we're not feeling well, we're anxious or depressed, or our consciences are burdened, that's actually a good thing. We need to be reunited to the church. We need to be receiving Christ's gifts. That being said, if we are using psychiatric treatments appropriately, we're talking about people that are connected to Christ and they are doing what they're supposed to be doing to maintain a certain level of wellness and health in their bodies, and we're using psychiatric treatments for that smaller percentage of people that do appear to have a genuine mental illness, then yes, I'd say they are effective. There's actually a study of this about 10 years ago in the British Journal of Psychiatry, and it tried to compare the effectiveness of psychiatric treatments to general medicine treatments, and they basically found that they were comparable. So that to me is reassuring. That says to me that when we're using these treatments appropriately, we can expect just as good of outcomes as we would from any other area of medicine.
Are psychiatric treatments typically given long-term or even for life?
That depends on the situation, of course. I mentioned in the first episode my dad's story, where he had a severe experience with depression that came on abruptly, and then when he received the appropriate treatment, it resolved abruptly, and he's been in remission after one course of treatment. So there are situations where people get the needed treatment, they recover, they go into remission, and they're fine. I think that's more likely to happen in certain disorders than others. For example, in my experience, there are types of anxiety like panic disorder or OCD and types of depression that will respond to treatment. And then the idea there is that we're using treatments to create a state of the brain where it can learn new things. We can open up this window of neuroplasticity. I like to talk about that as the ability for the brain to change. And so to take a step back here, when I think about people who are suffering with panic attacks or anxiety attacks or depression, there's something going on in the circuitry of the brain where it starts to get reinforced in a negative direction. You're having bursts of adrenaline and stress, and the body isn't knowing what to do with that, and so and there's no cause for it that we can tell. So something is misfiring or malfunctioning in the brain circuitry, and that can get reinforced by the certain behaviors that people do because they're having these symptoms, and then it can just become a bigger and bigger monster the longer it goes untreated. So with those situations, the idea is we treat it with some sort of intervention, whether that be medications or TMS or something else, and it creates a state of the brain where it's open to change and it's able to correct those errors or those misfirings. And I think it's really important to know, too, that it's not, I think for a lot of folks, it's not going to be as simple as just take this medication and the problem resolves. It's going to be more along the lines of take this medication or do this treatment, open up this neuroplasticity state, and then do something with that opportunity. You have to do those healthy behaviors, learn new things, learn how to ground yourself and to work through symptoms, improve your metabolic health, so that your each individual cell can actually respond to the stressors of life more effectively. And if you do those things and then you go into remission, then I think there are really good outcomes, and you can have a good expectation that you can taper off treatment down the road, hopefully. And I see that often. I will say too, when people are thinking about starting or stopping medications, we just have to be very cautious. It's never a good idea, I don't think, to start something rapidly and then stop it rapidly. We want to give the body time to adjust, adapt, and change in a safe and comfortable way. So if anyone's out there and listening and they're thinking about coming off medications, just a word of caution to just do that carefully. Now that's one set of situations, in my mind, more along the lines of depression, anxiety. I will say too that there are other disorders that are more likely to be needing chronic, like longer term treatment. And that would be things like schizophrenia and bipolar disorder. Some of those more severe forms of mental illness, they tend to be a kind of slow deteriorating process or a remitting, relapsing sort of pattern. And so long-term treatment, at least to be followed by a psychiatrist or mental health provider, whether you stay on medication long-term or not, that would probably be the case more often than not.
So with so much confusion about diagnosis and treatment, where would you recommend someone start? as a Christian psychiatrist?
Yeah, for most people that are listening, and most people out there, they're going to be on the mild to moderate side of the spectrum when it comes to mental health symptoms. They're going to be things that are annoying, frustrating, and disruptive, but not an emergency. And for those folks, what I would always say is you want to have kind of a multi-layered approach to kind of surveying your life and doing a little check-in to see where might the issues be coming from. And as a Christian, the first place I would start would be with spirituality. I would start with, are you going to church? Are you receiving those means of grace? Are you reading your Bible? Are you in your Christian community? Are you being fed spiritually? And if not, you ought to. Of course, that's where you need to start. And many people, I do think, will feel better once they resolve that piece that's missing in their life, the most important piece. Now, even in that community, though, of faithful Christians, there's going to be a certain percentage of people that do continue to have disruptive symptoms. And as a medical provider, then I would start thinking about the kind of what I call the pillars of your health or the pillars of wellness, the basic inputs of your body, the things that promote wellness, and to see if there's anything that could be improved. So number one, sleep. Sleep is the foundation. We all have to sleep, and if people are chronically sleep deprived or have disrupted sleep from obstructive sleep apnea or something like that, no one feels well when they're sleep deprived. So you really have to master sleep, have good sleep hygiene, and have it regularly. In my mind, the next most important thing would be food and diet. I think there's an increasing community of people out there that are finding that they're allergic to certain foods or insensitive to them, especially with all the different types of processing out there. So it's very important to emphasize that if you eat nothing but fast food, that's going to affect not only your gut and your weight and your metabolism, but the gut microbiome. And the gut microbiome will then participate in the levels of inflammation in the body, and they actually participate in the synthesis of the neurotransmitters that your brain uses to communicate. So it's all connected. The brain and the gut connection is very real. And if we neglect to feed our bodies good things, it's very hard to expect that you'll feel well in that sitting. So if you got to look at what you're eating, make sure you don't have food allergies or insensitivities. But then beyond that, try to eat whole foods, try to eat a well-balanced diet, healthy proteins, vegetables, of course, minimize the unhealthy fats, but there are good fats out there too. So there's a huge debate out there about what diets should look like. But just to make the point that it's very important and people should be looking at it closely. The next thing I'd be looking at is exercise. Are people using their bodies? A lot of us nowadays are living sedentary lives or working jobs that are at desks, and that is just not good for us. We're not created to be sitting all day long. We need to be moving, strengthening our bodies, improving our flexibility, and those sorts of things. And that actually does have large impact on mental health symptoms. There are really good studies out there that show very large effect sizes for exercise with regard to treating depression and anxiety. So that would be a big piece too. Another one would be light and dark exposure. I think most people are familiar with the circadian rhythm idea, but that is very important. There are people that are not synced up with the sun. They have night shift or they spend all day long inside. And again, you can't really expect to feel well when you're not getting outside sunlight exposure. That helps regulate your energy, your mood, even your sleep at night. So that's very important. And even some people have what's called seasonal affective disorder, where they have worsening of their symptoms during the winter season. So if you're one of those persons, you need to be aware of that. And there's things you can do. There's bright light lamps that you can use to really improve those symptoms during that time. And then finally, as a part of the basic wellness category, I'd be telling people to look at their relationships, interpersonal relationships in their family, at work, and meaningful work. Are you serving in your vocation? Do you have responsibilities? Do you have people that you're looking after? Are people looking after you? And how are you interacting with others? So if those are falling apart, or if those are traumatic, or if those are not in good shape, it's very hard to feel well. So again, I would start with Christ and the church. I would go to these pillars of wellness and health. And then assuming that all of that is basically normal or tuned up as well as you can expect, then if you're still having symptoms, and there are people out there, then that would be the most appropriate time to seek out a medical evaluation, make sure that you're not missing something like a thyroid issue or some sort of metabolic issue, and work with a psychiatrist or mental health provider to maybe put some language to the symptoms that you're experiencing, and then pursue evidence-based treatments. So I think for most people, that's the structure I would recommend, a kind of stepwise approach. The exception to that would be the extreme life-threatening situations. Folks that are acutely suicidal, thinking about suicide right now, or folks that are catatonic or manic or acutely psychotic. These are people that it's not appropriate really to say, well, go eat some better food and take a walk once a day and come back in 6 weeks or 8 weeks or whatever. These people, they need to be supported now. And that is not going to just involve a psychiatrist, although in many of those situations, a psychiatrist would be needed. But any resources available, you need to involve the family and the church, social workers, psychiatrists, therapists, anybody that's available in those situations. You really want to just use every tool available.
Dr. John Flo is our guest. We're concluding our 3-part series on Christianity and psychiatry. On the other side, we'll get some examples of the scenarios he has laid out for us.
This week on The Word of the Lord Endures Forever, we continue our work through the Psalter, considering Psalms 123 through 127. I lift up my eyes. Our help is in the name of the Lord, as the mountains surround Jerusalem. Home with shouts of joy, and unless the Lord builds the house. Join me, Pastor Will Whedon, for The Word of the Lord Endures Forever, your daily 15-minute verse-by-verse Bible study on demand. Listen at thewordendures.org or your favorite podcast provider.
Educating a new generation of Lutherans. You're listening to Issues, Etc.
Thank you.
Thank you.
Thank you for your service.
Our church loves and is grateful for those that serve our country. Operation Barnabas, part of Ministry to the Armed Forces, equips you to reach out to veterans in your community to bring Christ to those that served. Call Ministry to the Armed Forces at 314-996-1337 or email lcmschaps@lcms.org.
Thank you for your service.
Thank you.
God bless our military.
Welcome back. I'm Todd Wilkins. This is Issues, Etc. Dr. John Flo is our guest. We're concluding our series with him on Christianity and psychiatry. You laid out some scenarios before the break. Can you give us examples of these?
Sure, yeah. So in the first scenario, the one that's more of a stepwise approach, is a good example. I was working with a Christian woman. She was overall healthy. She was fit, enjoyed exercise, eating well. She was recently married and had gotten pregnant early on, and things were going well. During pregnancy, there were some changes. There was, the normal pregnancy changes, of course, including significant weight gain. But during that period, there was a rise of anxiety for this patient. She considers herself a very tough person, very resilient, but the anxiety that she was dealing with was starting to wear her out and to become really burdensome to the point where she thought, out of love for my husband and my family, I should see if there's something I can do about this anxiety that I'm struggling with. So she opened up, she started talking about it. Some resources were shared with her just from her community. She read some books, and those provided insights that were helpful. And she said to me that she felt like the ideas made sense, but it didn't change how she felt. And so she then pursued care through her primary care. After establishing that there were no major medical issues that needed to be addressed, they did start a medication. And interestingly, she described that as like she felt that her brain kind of opened up or relaxed in a way that allowed her to really internalize the things that she was learning in her books that she was reading. So it's a fascinating thing where she had the information she needed, but it didn't feel different until the medications did something to her physiology to make her really grasp it and to apply it in her life. She was in treatment with her primary care and this medication. And then eventually she also sought out therapy. And her therapist was able to provide further insight and really distinguish the type of anxiety she was having and more appropriately label it as OCD. And that actually made the biggest difference because now she could really target those OCD symptoms directly, put a name on them, and do the behaviors that are needed to relearn, kind of retrain the brain to improve those symptoms and become more functional. So for her, it was very much, she did the lifestyle stuff, the self-help reading piece, and then she sought out medical evaluation, and the really big change happened whenever she started medications, and then she was further optimized by the therapy on top of that. Now, that's very different than other patients I've seen, especially working in the hospital where I did my training. There was this one day, and this story will always stay with me because it was so profound. I got called to the emergency room to see a patient who was not responding. They were unresponsive. And the medical team was confused because they didn't have any clearly abnormal labs. Their vitals were stable. They were just laying there in the bed, not opening their eyes or speaking, brought in by family for concern that they had been doing this at home as well. And so the idea was, well, maybe this is catatonia. And so for those who are not familiar with catatonia, it's the state where people are not responding. Well, there's different types, but the more common type is an unresponsive patient who's not speaking, they're not moving, they're not responding to pain stimuli, and then they have certain characteristics like this kind of waxy flexibility where you can kind of move their arms and legs and they kind of hold that position indefinitely for unclear reasons. So with this person, then that was the idea. I was going to go down there and do a physical exam and see if they had these signs and symptoms. And sure enough, they did. I would talk with this person. There was no response. I moved their arm to see if they would react to me touching them. And of course, the whole time I'm telling them what I'm doing. I'm trying to get consent, but there's no ability to do so because they can't respond. I eventually did some maneuvers to try to stimulate pain. So I pinched his finger and rubbed on his sternum to see if he would wake up. And no response again. So then I maneuvered his arms and legs, and sure enough, he had this what's called catalepsy, where he holds the position. And so I became pretty confident that this was, in fact, catatonia. So the appropriate treatment for that, interestingly enough, is a medication that's a sedative. It's a benzodiazepine. We typically use lorazepam. And so for this person who is not responding, we gave him a sedative in the form of IV lorazepam, and within about 1 minute, his eyes opened up and he started speaking to me. And it was amazing. I was blown away, and I said, "Did you hear me? Did you feel the pain that I was inflicting on you?" And he did say that he could feel the pain, but he couldn't respond. And so he had been trapped in this brain state. And now the basic question, though, still was what caused the catatonia, because that's not a disorder in and of itself. It's usually caused by something else. And as I was speaking with him, it became kind of obvious that there was something psychotic going on. There were some delusional statements he was making. At that point, he was admitted to the psychiatric unit, and I actually didn't care for him after that point, so I can't say what happened in the next couple days. But it's likely that what was going on was there was a psychotic or bipolar illness, and then he became catatonic, and then his family brought him in, and that was the course for him. So he will need probably long-term treatment and lots of support. But that was a very clearly different type of situation than the first situation with the generally healthy female struggling with anxiety.
So what would you recommend, or when, I guess, would you recommend someone listening to us seek psychiatric treatment?
Yeah, and that is sometimes a very hard judgment to make, like we've talked about before. There are situations that are clear, like the story I just told. But for most people listening, there's going to be some sort of, how long should I be putting up with these symptoms? What's normal? What's not normal? That is still fundamentally the biggest challenge in psychiatry, is defining what is normal and not normal. So it's a hard question to answer sometimes. But I think as a starting point for Christian listeners, the Christian community here, I think we just need to give ourselves permission. There's a lot of Christians that won't seek treatment just for whatever reason. They don't feel like it's faithful, or it's illegitimate, or it's not effective. Again, there's all sorts of concerns that need to be addressed. But in general, just as a starting point, Christians should be given permission to seek out some sort of evaluation and treatment if it's appropriate. And this is nothing new. If we want to go all the way back to Luther, like I mentioned in the first episode, he talks to folks who are depressed, and he talks about medical treatment as well as spiritual care. My brother also shared with me a letter he wrote in 1527 to a colleague who was struggling with the idea of, should someone flee from the plague that was going on? Or should they stay or should they flee? And, of course, in that letter, he talks about those decisions are hard. They need to be made with love for your neighbor in mind and appreciation of your specific vocation. But also in that letter, he talks about using appropriate treatments. And in fact, neglecting reasonable treatment and just expecting to be healed miraculously is a form of testing God that's not good. So, if Luther talks about medicine as complementary to faith, then I think we, in good conscience, can do the same. And so just with that as a starting point, then the question still remains, at what point should you consider an evaluation? And again, as a Christian, I would think about two main things. One is receiving God's gifts. Are your symptoms so bad that you can't regularly come to church? For example, you can't drive to church because you're having panic attacks every time you get into a car. Or you can't have a rational conversation because you're having delusional thoughts or psychotic symptoms. Things like that. If it's preventing you from engaging in the gifts that God wants to give you through the means of grace and through the word and sacrament, then that's obviously a problem. It's worth looking into. The other piece is your vocation. And as Lutherans, we have a strong theology of vocation, and we emphasize how important that is. So if your symptoms are getting in the way of you completing your vocation and serving others, then again, I think it's worth looking into. And I would go through all those steps that we discussed earlier, making sure you're doing all the basic stuff right first, assuming symptoms are mild to moderate. If they're severe, of course, seeking out treatment faster. But again, it is a judgment call, and it's very hard to know what's normal and not normal, especially on an individual basis if you're isolated. So I think that's the other huge strength that we have as a Christian community, is that we're all a part of the body of Christ, and we need to be involved in each other's lives and serving one another. And in the community setting, if you're not feeling well and or others are noticing something is not good or is changing, getting worse consistently, or a huge break from your baseline normal function, then that's a very reasonable time to seek out an evaluation. And so that's my hope, is that as a Christian community, we can do that for one another, and then we can help people get the care they need so that they can have these barriers removed and continue to receive God's gifts and fulfill their vocation.
Dr. John Flo is a board-certified psychiatrist practicing in Missouri, a layman in the Lutheran Church of Missouri Synod and son of an LCMS pastor. Dr. Flo, thank you.
My pleasure. Thanks, Todd. In
Hour 2 of Issues, Etc., it'll be a part 4 of our series on divorce and remarriage with Dr. Benjamin Mays. Then Dr. Jordan Cooper of Justin Center joins us to answer the question whether or not the Nephilim in Genesis 6 and Numbers 13 are spiritual beings.
We love our on-demand listeners. You're listening to Issues, Etc.